Thank you, everybody. So I'm going to talk to you today about Eastern Health's No Unnecessary Tests, or NUTS program, as we like to call it. So NUTS has a long history at Eastern Health. Work actually commenced several years ago in the emergency department at Box Hill Hospital, and it was sort of born from a conversation between some clinicians in ED who were querying the number of normal results that were seen, huge numbers of normal results, and the question was asked as to, why were people requesting tests that really didn't seem to enhance or impact on patient management, and what benefits were there to requesting all of these tests. So, and a lot of the initial work to get the project up and running was done by our clinical director of Box Hill Emergency Department, who's Associate Professor Debbie Leach, who's in the audience today. So in 2012, one of the first parts of the project was a urine micro and culture project where a decision support flowchart was developed, and then we managed to bring some more sort of Eastern Health wide people on board, and a steering committee was formed with an ED subcommittee. In 2014, some consensus guidelines were written around ordering of pathology tests in the ED department. And then in November 2015, Dr. Paul Buntine, who's one of the ED physicians at Box Hill, embarked on a NUTS sabbatical, and that was really where the NUTS program took off at Eastern Health. Paul's work resulted in the NUTS program being the recipient of the 2016 Victorian Public Healthcare Awards for Quality and Safety, which is an amazing achievement. And it also resulted in us being successful recipients of some funding from Better Care Victoria to continue the NUTS program and expand into the Maroondah and Angliss Hospitals emergency departments, into our general medicine program and into our intensive care units. So NUTS basic principles are very simple. We want to ensure that we do, patients should receive investigations that will benefit clinical decision making, and only those sorts of investigations. Tests shouldn't be undertaken that are unnecessary, where evidence shows no benefit, or where they may be appropriately deferred to an ambulatory setting. So benefits, NUTS program, reduction in patient harm, improvement in patient experience. We've seen good benefits in efficiency in terms of time saving for clinicians, pathology and radiology departments, improvements in patient flow, and there's obviously a sort of a flow-on effect and cost benefits associated with those. So the methodology that we use is sort of multifactorial. The program is clinician-driven. We have teams of clinicians who are champions from the various programs, and they identify tests to target in their particular programs. Generally, we have a sort of an audit process where we look at a number of tests and assess the appropriateness of those tests in a particular patient diagnosis. There are decision support and clinical pathways developed. There's an example of a clinical pathway on the right-hand side there that was developed. This is the urine pathway. We've also recently introduced what we call a test of the month focus, which we build on top of our sort of underlying education and information program to help embed learnings, cultural change and changing clinical practice. So one of the other things that we do as part of our Test of the Month focus is we do a lot of education and advertising. We have signage, we have posters, we have all sorts of things going on. And we have a bit of a gamification approach as well, where we try and have competitions and various ways of raising awareness, but also keeping it fun and keeping people's interest. And one of those was a meme competition. So I'll just show you next one of the memes. For those that are Game of Thrones fans, you'll recognise this scene, and for the others, I hope you get the gist. So what have we achieved to date with our NUTS program? Well, the next slide shows a graph of the number of tests ordered over the last probably almost 3 years now, over our 3 emergency departments, and these were 5 targeted pathology tests that were considered low-hanging fruit. We've heard that phrase before today. These numbers are adjusted for patient presentations, so we've had a large increase in activity over the ED departments at Eastern Health over the last couple of years. But you can see that with the increase in activity, our test numbers have decreased dramatically, initially during Dr Montine's sabbatical, and we've had further decreases as we've implemented additional strategies with the BCV NUTS program. So the next slide is quite complex, so I'll just talk through it quite quickly. So the first column there is just a list of raw test numbers, annual test numbers for the 5 targeted pathology tests, and there's also CTPA, which is CT pulmonary angiogram, which is a medical imaging test, listed down the bottom there. So if you do some very quick maths, you will get to a figure for the annual number of those 5 targeted pathology tests before we implemented any test reduction strategies of about 86,500 tests per year across the 3 emergency departments. So over the course of the last 2 years, in the column that's now highlighted in red, you'll see that we've achieved some very significant reductions in those test numbers, from around 30% for coags up to a massive 60% for our venous blood gases. So C-reactive protein and venous blood gases have been our big wins, but we've had some, fairly significant improvements in our other tests as well. So moving across quickly to the next column, you can see our test numbers have reduced, by anywhere from 30 to 60%. And if you do some more quick maths in the final column, you'll see that there has been a 40,000 test reduction over those 5 tests since we've implemented our test reduction strategies. So a saving of 40,000 tests a year has got to have resulted in some efficiency improvements and cost savings across the organisation. So I'm just going to talk a little bit more about venous blood gases, which was one of our big successes. And you can see from this graph in the orange area, our gases were cruising along at about 70 gases per week per 1,000 patient presentations. With the implementation of our BCV NUTS program, we start to see a decrease in the pale green, and then the darker green there is when we had our venous gas test of the month. And you can see that the extra focus that we put on a particular test during that month has managed to bring the testing levels down even further, and we've seen a sustained level of testing at around about 30 tests per week, per 1,000 presentations for over 4 months now. So quite a big success. Recently, in February of this year, we expanded into the general medicine program. And although, it's very early days yet for Gen Med, you can see that in February 2016, before we started the program, we were ordering over 2,000 tests. These are raw numbers, not adjusted for activity. Over 2,000 tests a week. We're now down after, at the end of March, to 1,900 or 1,700. 1,900 U's and E's. These are high frequency repeat tests that are performed in the Gen Med program. And that represents a decrease of 10% for U&E and 16% for FBE. And having just done some more data analysis yesterday, I can say that at the end of April, those figures are now down to 17% reduction for U&Es and 21% for FBEs. So that's pretty impressive. Intensive care came on board in April of this year, so just at the beginning of this month, and we've seen a 23% reduction in daily chest x-rays in in the 2 intensive care units across Eastern Health. So early days, but good results. Our next steps for the program, lots of scope for expansion. We're looking at targeting some additional imaging tests in emergency and general medicine, and there's plenty of scope to expand into other programs and into other areas of inefficiencies. And just as a last, I just wanted to acknowledge a few of the contributors. So Better Care Victoria, obviously, for funding to support our project. The project team, which is quite large and probably too many people to mention, but in particular our 2 project leads, Dr Paul Bontine and Associate Professor Debbie Leach, our physician champions across the 3 programs, the pathology and medical imaging departments who've been very supportive, and last but not least, our ordering clinicians who've taken on board our test reduction strategies and helped to make the program the success that it's been. So thank you very much.